Morning, Lehigh County, week after the St. Patrick's Day weekend, where, I don't know about you, but I was in several parades and a number of different festivities. The Lehigh County really comes out for St. Patrick's Day. With me today is Seth Campbell. He is a street doctor and has just finished participating in what we had was the 100-day challenge. And we'll get to Seth in a minute. Some county news and what's going on. The Lehigh Valley Economic Development Corporation had their large announcement last week. We're very, very proud that in the United States, when you rank areas from 200,000 population to 1 million, we now rank number 5. We are the 57th or 59th economy in America. This valley is now past Vermont and Wyoming as far as economic development. And I think a lot of that comes about because of our regional planning, because of our cooperation of all our municipalities. So it is definitely a joint effort, and we need to say thank you to all the members of the Economic Development Corporation, the Planning Commission, the Chamber of Commerce, the labor unions, all of them working together to make this the best place, well, the 5th best place in America as far as economic development. Also this week we had a ribbon cutting. Kids Piece has moved into the Sacred Heart Hospital with an adult and juvenile mental health clinic and seeing over 50 patients a month just as walk-ins. Also there at Sacred Heart, the Workforce Board has opened up an employment center. So we're trying to go where the people are to make sure we can get them the jobs they need to have a sustainable lifestyle in Lehigh County. And at the other end, though, we have just learned that one of our biggest problems is housing. And as we found out in the 100-day challenge. So we are working on that. And Seth, 2 roles that you have besides the 100-day challenge. Being a street doctor, you want to start with that a little bit?
So yeah, I'm a full-time physician assistant with Lehigh Valley Health Network Street Medicine. So we serve our folks out in the community in soup kitchens and clinics. We are out in the woods seeing folks on the streets and bringing medication to them. Like you were saying, going to the people. That's what we do. We just bring backpacks with everything that we need to see our patients, including medications to dispense on site.
Yeah, it's in the perfect world, we would have doctors' offices on every other corner. They would be open. But now, with what was going on, this I think is I imagine you have a lot of stories to tell. This past week, I spent the day volunteering for Meals on Wheels.
Sure.
Another unbelievable, worthwhile program in this area. Now, about the 100-day challenge, how did that go?
So the Trexler Trust brought in the Rapid Results Institute to bring system leaders together and then form a team of service providers in the local community here in Allentown to set off on a 100-day challenge. The goal was set at housing 50 households in 100 days and preventing 25 households from entering homelessness. We met that goal, but at the same time noticed many barriers as far as the data collection and really the barriers that our folks face. And ultimately, over the 100 days, we noticed that prevention was really the key point. Prevention is where it's at, keep folks where they are. You know, we have a family, you know, that had a major medical bill or got laid off and, you know, they're on the brink of homelessness and they just recently got a job. They're late on their rent, just a couple $100s, and one of the service providers could intervene right then and there, and you know, then they're stably housed again. That's really the most, if you will, bang for your buck.
And I think when you say bang for your buck too, anything we can do in the prevention side
Correct.
definitely saves the taxpayers on the other side.
Correct.
So these are the kind of programs I'm very appreciative to the Trexler Trust
Yes.
for sponsoring this. It was eye-opening, and the fact that we met our goal thanks to the hard work of all of these people that volunteered and put in the time over 100 days. I think, and just bragging as the county executive, but one of the great parts about Lehigh County is the volunteers that step forward. We have a lot of problems yet to solve, but this was an idea that came about because there was a problem. How can we solve it and do it within a reasonable time? And everybody was given a task, a goal, and they met it. So you could say, I won't say we hit a home run, but I think we got to second base on that and started it a little bit. Well, thanks, Seth, for joining us today.
Absolutely.
And God bless you for what you do out there every day. Really appreciate it.
Thank you.
We won't be on the air next Friday, but the week after, and I'm sure you don't mind not seeing us for 1 week. Again, stay safe, be nice to everyone you see, have a good week.